Good morning and welcome to session 1 of the 2020 Autism Hope Summit. This presentation is titled Navigating Resources for Families of Children with ASD and is presented by 3 of our family navigators from the STAR team. I'm going to introduce the 3 speakers, then turn it over to them for the presentation. Stephanie Tharp earned her Master's of Teaching degree at the University of Virginia School of Education and Pedagogy. Stephanie is a mom of 3 boys, and the eldest was diagnosed with autism at UVA in 2005. She has years of experience navigating the various medical and educational avenues available for children with autism. Karen Orlando earned her Master's of Education for Intensive Special Needs at Simmons College. She worked as an autism teacher and specialist in elementary schools for 8 years and MA. She then started a consulting business for teachers and families of children with special needs and provided social and skills instruction for 12 years until she moved with her family to Virginia. Debbie Vermilion earned her Bachelor of Arts from the University of Lynchburg in Speech Communications and spent 15 years working with local preschool children and their families. However, most of her experience with autism comes from helping her now 28-year-old son navigate diagnosis, therapy, educational, psychological, and transitional services. She also volunteered on many boards and committees dealing with autism and other disabilities. Thank you.
Okay, thank you, Isa. My name is Stephanie Tharp, and both Karen Orlando and I are Family Navigators for Autism at UVA School of Education under the Links Grant for the STAR Initiative. Also joining us is Debbie Vermilion from the UVA Children's Hospital, where she is a patient and family navigator at the Developmental Pediatrics Clinic. Excuse me. As we go through resources, we are not recommending a particular business or service. This information is intended to inform of the types of services available excuse me, to families of children with autism. There are many different services and providers, and it is up to each family and practitioner to determine the most appropriate service and provider based on specific needs. Through various classification systems, we will identify what resources are available and where they are. We will explain what they do and why they are important. This presentation is primarily designed for newly diagnosed families up to the age of 12. It is intended to help families navigate through the first steps after diagnosis. This may include early intervention services, communication with schools, accessing therapies and supports, as well as parent trainings. Instead of providing you with slides of this presentation, a recording of the webinar will be available on the Autism Drive. If you are unable to jot down notes, we encourage you to watch it at a later time. If you go to the Exhibitors tab found on the start page of the summit, there is a list of website links for the organizations we will reference in this presentation. We have divided the navigation of resources into 6 main categories. We have done this from the point of view of the families and individuals seeking the resources, as well as professionals supporting them. Our goal is to provide starter information, as well as going deeper into the facets of each category. Our goal as family navigators is to make sure each area is considered for a child newly diagnosed on the spectrum or a child who is further along in the implementation of each of the categories. Before we get started on the services available under each pie slice, we first want to make you aware of the major online directory for autism at UVA. Here is the website link to the Autism Drive, which is a database of autism resources for professionals and families in Virginia. The Drive has categories that are similar to the pie categories, but it goes a lot further into topics and subcategories, so you can search by topic or age group. Later on, I will be referencing how to search by using a keyword. Now, Karen Orlando will delve into the topics of education and then treatment and therapies.
Hello, everybody. I'm Karen Orlando. Thank you so much, Stephanie. So we're going to start with education as our first pie slice today. There are 2 paths for children with developmental delays in education. If they're identified under the age of 3, they will be referred to early intervention. If they're approaching 3, or older than the age of 3, they will be connected with the special education office in the public school system where they live. Both types of educational services offer individualized plans for children to meet their needs. If you are new to special education process, you'll find that there's lots of acronyms and things, but we're going to help you through that. And there's tons of resources available to help you get through that process. Next slide, please. A child and family may receive early intervention supports and services if the child is up to 3 years old and has certain levels of developmental delay, differences in development, or a diagnosed condition. When a family has concerns about their child's development, they can talk with their pediatrician and a referral can be made to early intervention for an evaluation. Once a referral is made, an early intervention team will evaluate the child and talk with the family to determine eligibility. You'll be assigned a service coordinator to help the family through the process. And if eligibility is determined, assessments will be done to plan services for the family and child, and an IFSP will be created by the team. And that's one of our first acronyms we're going to talk about. And we'll dive into that in the next slide. An IFSP is the Individualized Family Service Plan, and it's a mouthful. So an evaluation will be done and an IFSP will be developed. The evaluation will determine what services are needed, including the number of weekly visits by therapists and how long the visits will be. Services may include social skills, speech and language, thinking and problem solving, feeding, and safety. Therapists will visit the home or meet with the family in the community to deliver therapies. And an example of meeting in the community might be if the child's working on gross motor skills, they might meet at a playground to work on those skills. So the team will answer questions and provide feedback and support to the parents and teach parents how to continue practicing skills throughout the rest of the child's day and week. As your child approaches the age of 3, they will work together to create a transition plan to transition your child to preschool in Head Start or in public preschool. Next slide, please. If you have concerns about your child's progress and your child is over the age of 3 or approaching 3, you will contact your local school district special education department to request an evaluation. Families should first reach out to the school district by phone to find out who specifically they should send a letter to for a request of evaluation. You can verbally, and you should do this, request the evaluation, but you should definitely follow up with a written letter. And there's actually some great examples of request for eval letters online that you can use as a model to help you with this. We provide a resource for that as well. A referral for special education evaluations will be made to the appropriate service providers. For example, the special education teacher, autism specialist, OTPT. And then once the evaluations are complete, a review of the evaluations will be done and determination will be made about whether or not the child qualifies for an IEP. Next slide, please. When the child qualifies for a special education services, an IEP is an individualized education program, another bunch of letters for you. When a child qualifies for that special education services, the team will meet to develop the IEP. The team consists of you, the parent or guardian, and you're a very important part of that team. And when it's appropriate, the child can even be part of the team as well. The child's teacher, a special education supervisor, specialists in the areas that are addressed in the evaluation, such as speech or OT or a psychologist, any other participants you or the school. This might be someone who has done an outside evaluation or a child's therapist, for example. If the child is determined to be eligible for an IEP, a plan will be developed. The plan will have measurable academic and functional goals. They will state where the instruction occurs, whether it's an inclusion setting, separate classrooms, small groups, things like that, and lists of services and supports. Families will receive regularly scheduled progress reports, typically quarterly or trimester basis, and the team will meet to review the IEP and services on a yearly basis. And then at least once every 3 years, a reevaluation will be done. Next slide, please. So the previous slides were a super brief overview of 2 very in-depth processes. Both are the subject of lots of available trainings, and there are many supports available to help families navigate the process. These are some resources that can help get you started. And these resources, again, will be provided in the follow-up information sent to you after the summit. So don't worry about retaining all of that right now. Next slide, please. So now we're going to jump into treatments and therapies. And there are tons of treatments and therapies available to families and children. Families can talk with their pediatrician and early intervention or special education providers to come up with a plan of what treatments and therapies would be most beneficial. It is always a good idea to choose treatments and therapies that are evidence-based. And what that means is that they've been proven to be effective. The most common treatments and therapies you are likely to hear about first are ABA, OT, speech, and PT. And we're going to go over those today, but there's lots of others. So let's start with ABA. Next slide, please. ABA is often thought of as just a service for reducing behaviors, but in fact, it's a teaching method for teaching new skills as well. It can be used to teach communication, play skills, academics, etc. ABA identifies what behaviors families and educators want to see increase or decrease, and they create a plan based on the function of the behaviors. The goal is to increase positive behavior, such as communication, academic skills, etc., and to decrease the challenging behaviors. Next slide. ABA can address learning difficulties. It can help break down new skills into small steps to make them more achievable. ABA is an effective way to help with teaching communication for both verbal and nonverbal children, and it addresses problem behaviors that impact acquiring new skills. For example, if a child exhibits tantrum behavior when they are asked to participate in classwork during which they will learn new skills, ABA teaches the children how to appropriately request a break and seeks to increase the duration of participation in that classwork by providing reinforcement to the child for participating. They might start off with just a few minutes and then gradually increase time in learning between breaks. Next slide. So now we're going to talk a little bit about speech and language therapy. Speech and language therapy focuses on both the ability to create speech and the ability to use language to communicate. Articulation is the actual sounds made, and receptive language is the ability to understand language, and expressive language is the ability to communicate with others. Both expressive and receptive language can be taught to verbal and nonverbal learners. And then augmentative communication is using something other than verbal language, such as a device or pictures to communicate. Speech therapists can help decide what the most appropriate augmentative communication is for a child and if it's needed. And augmentative communication can also be used for students who have verbal language, but it can help increase their language skills. Next slide. So what happens in speech therapy? Speech therapy is often one of the most fun therapies for children. Therapists will focus on predetermined goals in fun ways, and it involves lots of games and stories that allow children to practice the skills. Next slide, please. So now we're getting into OT and PT. OT focuses on fine motor skills that involve hands, fingers, and even toes. Services can also work on visual perceptual skills, cognitive thinking, and sensory processing. PT focuses on the gross motor skills, so those big muscle movements, and it helps with developmental activities such as crawling and walking, or developing core strength and increasing range of motion. PT can help with balance and coordination and even safety. Next slide, please. So what happens in OT and PT? Similar to speech and language, OT and PT are often a fun part of a child's day, and it's something that they look forward to. They do work really hard, though, with their therapist to develop the skills, and strength, but they are usually done in a fun and age-appropriate way using lots of games and fun tools and equipment. OT and PT both improve physical skills, which result in improved self-esteem, ability to participate in daily activities, which results in improved school performance. Next slide, please. So here is a list of other types of treatments and therapies available, but Stephanie will be reviewing the EVA Autism Drive, which is an excellent resource to help you find services in your area. Thank you, and now Debbie is going to go over financial supports.
Thank you, Karen. I'm Debbie Vermilion. And upon diagnosis, one of the first questions we as parents or as individuals with autism ask is, how can we financially support the primary services needed, such as medications, therapies, and assistive devices. Briefly, we're going to cover our options and the measures necessary to secure them. Next slide, please. So many of us are dependent on private insurance. We're going to be talking further about state mandates for insurance coverage, how to access your insurance benefits, and then the appeals process should you be denied coverage for services. We're going to focus on Medicaid later in the presentation. Next slide, please. So the Virginia insurance mandate was enacted in 2011, and it requires health insurance plans to provide coverage for the diagnosis and treatment of autism spectrum disorder. The plans that are issued or renewed after January 1st, 2020 must include coverage for all ages, and treatment must be determined to be medically necessary by a licensed physician or a licensed psychologist, and that must include behavioral health treatment, pharmacy care, psychiatric care, psychological care, therapeutic care like speech and OT, and applied behavioral analysis. Children cannot be denied insurance solely because they've been diagnosed or received treatment for autism spectrum disorder. The annual cap on ASD services for both private insurance and for Medicaid is $35,000 per year. So under current law, only the policies and contracts and plans that are issued in the small group market, those are companies hiring more than 50 employees, are required to provide such coverage. However, as of January 1st, 2021, the new law is going to expand to provide coverage to the individual and small market groups, those less than 50 employees, and self-funded policies. So next slide, please. So how do you access those insurance benefits? Well, first of all, you need to secure a formal diagnosis from either a developmental pediatrician, a neurologist, a psychiatrist, or clinical psychologist. And these medical specialists, they can issue referrals for the treatments that are prescribed. So to access a specialist, you need to ask your pediatrician for a referral for a comprehensive diagnostic evaluation. Some of the questions to consider are, what are my child's most significant challenges? What services will best meet their needs? Who's going to monitor these services to ensure consistency? Next slide, please. Oh, sorry, can we go back? Sorry about that. Also, number two, reach out to your insurance agent, the member services department at your insurance company, or your benefits representative at your human resources department, and inquire whether they provide benefits for diagnosis and treatment of ASD. And if yes, find out who the primary contact person is there that you'll need to speak with about the treatment you're seeking for your child. So questions to ask here. Are there differences in benefits for in-network and out-of-network providers? Are there any in-network providers in my area that can provide these services? Are there copays and deductibles associated with these treatments? How many hours is my child approved for services? What services are specifically covered, and who is and is not covered to provide specific treatments and direct services to my child? Does the provider I'm interested in submit those claims to the insurance company, or am I responsible for submitting those claims? And what comes next for accessing a provider treatment and continued insurance benefit? Number three, get the necessary referrals from your provider to attain the therapies and services needed, and support your service provider in working with the insurance company and get all the documentation determined to be medically necessary for approval purposes. Now, next slide. So what if you're denied by your insurance company? Well, don't stop there. Review the determination letter from the insurance company to understand why you've been denied coverage. This is important because it might be a simple fix, like a coding issue. Number two, collect information, including your insurance policy, the medically necessary criteria. That's the insurance company's lingo for determining whether they consider a treatment or service necessary for your child's condition. And call and ask your insurer for that determination letter, that policy and medical necessary criteria, and then get instructions for filing an appeal. Ask your healthcare provider's office for help with the appeals process. Either they can help you complete forms, they can draft a strong appeals letter, or perhaps even have to go peer-to-peer. Number 5, submit that appeals request, being certain to follow closely and implicitly all instructions from the insurance company. And then number 6, follow up until you hear back from them. Make sure you keep a record of who you talk with, the dates and times that you speak with them, and a summary of that discussion in case you have to refer back to it. So if you don't get a response within 30 to 60 days, then what you'll want to do is contact your Virginia Bureau of Insurance. Next slide, please. Medicaid in the United States is a federal and state program, and we're going to talk a little bit about Medicaid here. It helps with medical costs for some people with limited income and resources. In Virginia, Medicaid's primarily handled through managed care organizations, or MCOs, and a few people still have state-managed Medicaid. An MCO is an insurance company, basically, like Anthem and like Aetna, and it has a Medicaid division of it for its operations. Once you're found eligible for Medicaid, you're going to be able to pick an MCO that services or provides coverage in your area of the state. And then, similar to private insurance, you'll get to pick a type of policy. Most Medicaid policies are going to cover some speech and language therapy. They'll also cover OT and ABA, but they can differ in how much is covered and how it's structured. As we talked about before, the Virginia Autism Mandate caps those expenses at $35,000 a year. Most Medicaid policies have little or no copays. So if you want to find out more, please go to Cover Virginia. The other thing to think about is FAMOUS. FAMOUS is Virginia's health insurance program for children. It can make healthcare affordable for children of eligible families. And that eligibility is determined by family income and family size. There aren't any enrollment costs and there are no copays. And families who earn 143 to 200% of the federal poverty guidelines and who may not qualify for Medicaid or FAMOUS Plus, which is children's Medicaid, may have the option to purchase these plans. So if you're a little over the income guidelines here, something else you can consider is a Medicaid spend down. And that's like an eligibility calculation based on if you have a lot of medical expenses that Medicaid will make, and that's based on income and the bulk of those expenses. So basically what you want to do here is just apply for Medicaid, and then if you get denied, the letter they will send you, it'll give you instructions for going through that process of being evaluated for spend down. Next slide, please. So let's talk a little bit about waivers. There's two here in Virginia. One is the DD waiver, and that's coordinated through your local Community Services Board, or CSBs, as the acronym says. There's a long wait list for this type of waiver, and the funds are based basically on urgency of need and not on when you apply. So it may be worth applying because at some point your child's going to be able to access these funds and receive Medicaid health insurance as well as other services. And you're going to have access to the individual and family support program funds. These are currently up to about $500 extra a year. The CCC Plus waiver, this is a waiver that's intended for adults and children who have nursing care needs at the skilled level and who without the funds to support them in their home would have to be supported in a facility. So sometimes children with autism qualify for this because they have complex medical needs. If you're interested in learning more, you contact your local health department and you ask for the nurse that's working with those screenings. All right, next slide, please. So we well know that therapies and services can certainly be expensive, and some insurance plans may have high deductibles and substantial copays. So if you're income eligible, consider this, SSI or supplemental security income. That's a federal income supplement program, and it's funded by like general tax revenues, and they provide a monthly payment to people who are blind, aged, and have disabilities who are found eligible. And eligibility is determined really by family income and then an assessment of disability. There's a complicated formula called deeming, which is worth knowing about. Anyway, it's basically they calculate that and then recalculate it every month that you're on, SSI. So in Virginia, if you're found eligible for this program, then usually you qualify for Medicaid, but you still have to apply for that. All right, next slide, please. So, a lesser accessed federally funded program, but to some an option, is SSDI. That's Social Security Disability Insurance, and it's administered by the Social Security Administration. It pays disability benefits to, certainly you and certain members of your family, but you need to have worked long enough, so that you have accumulated benefits through Social Security taxes, and that you have a medical condition that prevents you from having worked for 12 months. So, you can certainly go to the Social Security Administration to find out more about that program. All right, next slide, please. So government assistance program. The idea here is that, that if you can qualify for assistance with food and energy costs and childcare and rent, then the more funds, would be available to put towards these necessary treatments and therapies. So the easiest way to have families find out if they qualify is to utilize the Common Help portal. And through this portal, you can link to applications for child care grants, housing aids, food subsidies, energy assistance, and other basic needs. Next slide, please. So also too, there's several private organizations you can take a look at that can help with grants, to pay for insurance premiums and co-pays. And those are, there's the Health Well Foundation, which pays for it out of their general fund. And the income cutoff for this is about 500% of the federal poverty guidelines. So for a family of four, that's about $131,000. Then there's United Healthcare Children's Foundation. The income cutoff here for a family of four is $115, but they cover co-pays for children up to 16 years of age. Autism Speaks, which a number of you might be familiar with, at their site has family grants that you can look at and apply for too. We'll have that certainly listed on our resource page at the end of this presentation and on the Autism Drive as well. One interesting program, Able Now, it's administered by the Virginia 529. It's an independent state agency and it manages the nation's largest college savings plan. And that helps individuals with disabilities to save money and to pay for qualified expenses. The great thing about this is that you can do it without being taxed on the earnings, number one, and number two, without losing certain means tested benefits programs like Medicaid and SSI. All right, next slide, please. All right, so moving on ahead, we're going to talk a little bit about some of those family support organizations that provide advocacy and information and training and other types of support such as safety programs and assisted technology. Next slide, please. So when we're talking about advocacy, there are organizations that help individuals on the spectrum through legislation, further education, and inclusion into the communities in which they live and work. And some of the best known are the Autistic Self-Advocacy Network, or ASAN, the Parent Educational Advocacy Training Center, or PETSI, and the ARC of Virginia. And again, all of these are going to be listed. Their information will be listed on the resource page as part of this presentation that you can access through the Autism Drive. Next slide, please. As far as information and training, are concerned, there are thousands of autism websites out there. We're going to choose to really focus on the sites that are evidence-based and reliable, and those are the sites that we have listed here. So there's a couple in Virginia, the Virginia Commonwealth University's Autism Center for Excellence. They're just for parents site. And then our own, very own UVA Autism Drive, which Stephanie will talk further about here later in the presentation and has already referenced earlier. There are national organizations too, such as Autism Speaks, and then the Autism Society of America. Next slide, please. So in other supports to be aware of, they're the parent resource centers. They're located throughout Virginia. They serve as information and referral sources for needed services available within a community. They're often connected with the local school systems, and they provide trainings for parents and educators. And then the Blue Ridge Care Connection. Blue Ridge Care Connection is a program that's sponsored by the Virginia Department of Health. It advocates for children with special health care needs. Then there's the Centers for Independent Living. They're all over the state as well, and they provide services for significant disabilities like advocacy, peer counseling, independent living skills and training, information and referral. Project Lifesaver, public safety organization, provides law enforcement with a program to protect and locate those individuals that might be prone to wandering. Service Dogs of Virginia, they raise dogs to assist people with disabilities. And VATS, Virginia Assistive Technology System, that has an array of services through the state. Thank you all, and I'm going to turn our presentation now back over to Stephanie to talk to you about mental and behavioral health resources.
Thanks, Debbie. Our next pie slice focuses on mental and behavioral health services available to those on the spectrum. Throughout Virginia, there are a variety of counseling services available. Some regions have more services than others, and we acknowledge that there are not enough of these types of services available to families of children with autism. The next slides will detail the types of counseling available. The VMAP system will be explained more as an alternative your PCP or pediatrician can use when psychiatric services are wanted for your child, but your family doctor wants to consult another source before proceeding with treatment. Also, to give you a brief introduction, Therapeutic Day Treatment centers will be best explained by taking a look at the state's Department of Behavioral Health and Developmental Services, also known as DBHDS. There are 3 types of resources that can be used during times of crisis: REACH, Family Preservation Services, and the local CSBs, which stand for Community Service Boards, which provide crisis services for families. Like we mentioned, your local CSB is a contact for learning about what types of counseling services may be offered. If a child has also been identified with an intellectual disability, also referred to as the acronym ID, they have a caseworker at their CSB giving them long-term support. If a child is on the DD waiver waitlist, they may receive episodic case management where an issue might need to be addressed. It can include IEP needs, connecting with certain providers, or supporting a transition like a new school. Many local CSB house their infant toddler connection programs, so families may already be familiar with their CSB because of the early intervention programs. Here is a map showing the breakdown of all the CSBs in Virginia. It can seem like a game of hit or miss when trying to find a counselor or psychiatrist for your loved one. It can mean matching various pieces together, your personal insurance or Medicaid, with the types of services offered by the practice, while finding somewhere that is reasonably close. If the stars align and you can match all of that, the appointment may be too far out and you need more immediate help. This can happen at any private practice and university or hospital clinics. A family navigator can help you search for a provider while keeping all these parts in mind. Please refer to the email on the slide, star-autism@uva.edu, if you're in need of help in this area. Next up, I will explain the Virginia Mental Health Access Program. Here are some steps to take to use the VMAP system. First, call your CSB first and make them aware of your child's situation. Meanwhile, contact your physician's office and ask if they are participating in the VMAP program or if they could look into it. As stated here, it is a weekday service where your child's physician can make the call to the program. It is not designed to have parents call in, but instead the doctors will have the initial conversation and the parents will be included later through care coordination. This includes the possibility of connecting through telehealth services. It is a government-funded project to help bridge the gaps in providing services for mental health issues. Therapeutic Day Treatment programs are not just specific to autism. They serve children, adolescents, and young adults through age 21. The services vary with what kind of circumstances are happening. It could be serious emotional issues, substance abuse, or co-occurring disorders. Services include evaluation, medication education and management, opportunities to learn and use daily living skills, and to enhance social and interpersonal skills. There's also individual, group, and family counseling. Even if families have not reached a point of crisis, the services can be utilized to diffuse the escalation issues pertaining to mental health. It is important that families become familiar with what their options are should the need arise. Referrals and requests for REACH services may be made by individuals, families, or service providers. The REACH program serves children and adults with a developmental disability who have significant behavioral and/or mental health issues. How much do REACH services cost? There is no cost. REACH crisis services are available to individuals who meet the eligibility requirements for the program as noted above. For individuals who utilize the DD waivers, REACH services are included in each waiver. Regardless of waiver status, any individual who meets qualifying eligibility criteria can access REACH services. Family Preservation Services, FPS, offers evidence-based and best practice services that are trauma-informed and licensed by the Department of Behavioral Health and Developmental Services. FPS takes a holistic approach to treatment and offers a variety of services and support programs designed to best meet the needs of our children, adolescents, adults, and families in the community. The final pie slice that we will talk about today takes a look at the types of recreation, sports, and social activities offered in Virginia for children with autism. They will be broken down over the next slides. Obviously, with COVID, a lot of these service activities have been suspended or limited, but they are still great to keep in mind when things return to regularly scheduled programs. There are a variety of camps available for kids with special needs, and sometimes specifically for children and adolescents with autism. Later on, I will show you how to use the Autism Drive to search for a list of camps in Virginia. Special Olympics sporting events and training are featured all over the world. Here in Virginia, communities are broken down into regions, and you can find your region by checking out the website specialolympicsva.org. Many kids and adults with autism enjoy these activities, and if they don't at first, maybe try back again later, or try different sports until there is one that fits. If there are obstacles such as sensory issues, it might be worth talking with those holding events to explain that your child with autism may need different accommodations. So with Virginia's geography, we have skiing in the mountains and surfing at the coast. Some ski places like Wintergreen can offer ski lessons that are tailored for those needing extra support. The costs can be prohibitive to make it a regular thing, but making a special day out of it can be a fun event. Some schools will use their resources to provide this opportunity. At Virginia Beach, there is a surfboarding camp that occurs every August that is free of charge thanks to local support. Registration opens in the spring and it fills up fast out of popularity. Last on our list are trampoline parks. There are some regularly scheduled hours for kids with special needs, so many kids are able to find that to be something that works for them. Parks and recreation events can be an affordable option when it comes to activities for your child with autism. Some cities and counties will have an adaptive section either on a website or in a catalog. Others might have an email or you can call about. If your child or school would like to tour a museum and needs special accommodations, call ahead and find out about any times that might work best. Some places will allow a caregiver to not be charged admission. Boys and girls clubs can vary as well from city to city, but offer an abundance of sports, arts, and social activities, which may feature inclusion-friendly activities. YMCAs are feature well-rounded amount of leisure activities to do, many times a pool. It might be a place to inquire about specialized swim lessons for those on the spectrum. Once again, we have the address of the Autism Drive, autismdrive.virginia.edu, and that link will be listed on the follow-up information that we send you, and it will include many of the links we mentioned today. On the next slide, I will show you a screenshot of the Autism Drive, and our hope is to show you how to search for topics using a keyword and also to use the filters. On this screenshot of the Autism Drive, you can see the navy blue tab at the top and the phrase Find Resources. When you click on that, you will see the white search bar appear, and that is where you type in your keyword. In this instance, I have typed the word camps and did not add any filters to it. The filters can be found directly below the white search bar. Using just the word camps, a list of 32 results were returned and 20 are appearing on this list to the left if you were to scroll down. Right now, only 2 are showing. In the middle screen, it says distance from me. This is a sorting feature that will determine how far a camp location is from you. When you look at the map to the right, you can see I typed in my zip code, and that will show how far the camps are from my home. You can see that the location details show how many miles away the first 2 camps are. If you look at the map on the right, it shows orange circles and the blue balloons. The orange circles have a number in them, and that is how many camps are at that particular place or city. The blue balloons are just single camps or just one camp at that location. So there are various ways to use the map and use the search bar. And there's also the sorting feature I mentioned in this. And in this example, it's called distance from me. There is a bit of a learning curve to learn the ins and outs of the Autism Drive. With a little practice, you will understand how to filter resources and find out what's in your area. At the top of the page where we started with Find Resources, you can see other sections of the drive, so please explore these to find more information. You can also create an account, which gives you a chance to join studies or save resources that you find. With COVID-19 restrictions, there was a pivot in our family navigation focus. The STAR Initiative researchers and staff have been conducting webinars. Our Facebook page was updated after the webinars with recordings. They are also found on Drive. Try typing the word webinar into the Drive search bar to see the variety of webinars available to watch. Please go to our STAR Initiative website or Facebook page to join our monthly newsletter. This email that you will receive provides updates on STAR happenings and possible future studies. The current research opportunities that are listed on Drive are mostly in survey form due to COVID. Many families will join studies because they offer educational testing or other types of benefits for their child. Thanks for joining us today. And should you have any questions that you'd like to address to the family navigators, please send us an email at star-autism@virginia.edu. Please enjoy the rest of the summit. And now back to Isa, who will tell you the next steps. Thank you.